In this second video of the Psychopathology series, we're going to attempt to clearly define the three psychopathologies this unit focuses on. So phobias, depression, and OCD. We'll do this by describing their characteristics. These are divided into the behavioural characteristics. So what do people with phobias, depression, and OCD physically do? Emotional characteristics. What do these people feel? And cognitive characteristics. How do these people actually think? Once we've done that, in the following videos, we can go on to explain these disorders in detail and look at the various treatments. Psychoboost.com, over 170 videos to help you with your qualification, and Patreon supporters can access bonus resources, tutorial videos, and the Discord channel. Behavioural, emotional, and cognitive characteristics of phobias. You are probably aware that a phobia is an extreme and irrational fear of some object, or when it comes to social phobias, some situations. Two of the more commonly known phobias are arachnophobia, a fear of spiders, and claustrophobia, a fear of enclosed spaces. But when we define phobias, we need to go beyond saying phobias are just about the emotion of fear. If we think about the behavioural actions of someone with phobia, what do they do or do not do? One common behaviour is avoidance. So for example, we can imagine someone's phobia of birds, which is called ornithophobia. Now let's say they see a pigeon land in the street in front of them. They may cross the street in order to avoid that pigeon. So this is what we would say is avoidance behaviour. They are physically adapting their normal behaviour to avoid a phobic object. The physical display of panic is also associated with phobias. This is an uncontrollable physical response, and it's most likely to happen at the sudden appearance of the phobic object. So they'll scream, they'll hyperventilate, they'll wave their hands around, and they may try to run away from the situation. There are other aspects to panic. But keep in mind, when describing the behavioural characteristics of these three psychopathologies, we need to focus entirely on the physically observable behaviours. One other behavioural characteristic might be a generalised failure to function. We expect people to carry out normal behaviours as part of day-to-day life. But if you've got a serious phobia, you might not be able to engage in the world in the way that most people do. For example, avoiding socialising outside if you're afraid of bees. Or you might find it difficult to hold down employment because you avoid going to work, especially if your phobic object is something that could be encountered at work. How about emotional characteristics? A phobia is an anxiety disorder, so anxiety is an emotional characteristic. This is an uncomfortably high state of arousal, as people with phobias are often constantly thinking about a possible future encounter with their phobic object. They're not able to switch off and relax and feel pleasure. You might have had a similar experience when worried about something coming up in your future, maybe an operation, a big exam, or an important interview. In the run-up, we can't relax and we're unable to feel much pleasure in our day-to-day activities. With someone with a phobia, this could be a constant experience. Someone with a social phobia can feel like this before what many of us would consider to be relatively minor social interactions, leading to a permanently high and uncomfortable state of arousal. We've discussed the behavioural characteristic of panic. The emotional aspect of this is fear. This is an intense emotional state linked to the fight or flight response. It's a sensation of extremely unpleasant alertness that will only go away when the phobic object has been removed. Cognitive characteristics are thought processes. When it comes to phobias, this means irrational fears. Phobia sufferers have an exaggerated belief in the harm the phobic object could cause them. The vast majority of spiders are completely harmless to humans. But someone with a severe spider phobia is convinced even the smallest spider is a deadly threat. Someone with a social phobia is convinced that something wrong they say in a conversation might have long-lasting or even permanent implications to their social life. Because a person with a phobia focuses their attention so much on these phobic objects and the danger they feel that are in, this leads to reduced cognitive capacity. They're not able to think about and engage in day-to-day life in the same way that other people will. So this is going to interrupt their ability to focus at work and conduct other tasks that they need to do or find pleasurable. Behavioural, emotional, and cognitive characteristics of depression. Depression is a mood disorder, so we generally understand this as a constant and long-lasting sense of sadness. But beyond this emotional characteristic, we can identify behavioural characteristics. There's likely to be a change in activity level. People with depression can be lethargic, which means they lack the energy needed to perform normal activities. They may also not have the energy to take part in previously enjoyable activities. This is called anhedonia. For the same reason, they may have poor personal hygiene, which is likely to be particularly noticeable and cause observer discomfort to people around them. There's often a change in eating behaviour, resulting in significant weight gain or weight loss. There can also be an increase in aggressive acts, which can be towards other people, but often these acts of aggression will be acts of self-harm. Moving on to emotional characteristics. It won't surprise you that sadness is a defining feature of depression. This is a very persistent, very low mood. Other emotions can include guilt, alongside helplessness and a feeling they have no value in comparison to other people. Cognitive features might include poor concentration. People with depression are not able to give their full attention to tasks, and when they need to make a decision, they're indecisive or unable to choose between competing options. People with depression will also have negative schemas. I'll go into these in much more detail in the depression video, but simply these are automatic negative biases when thinking about themselves, the world, and the future. Behavioural, emotional, and cognitive characteristics of OCD. OCD, or obsessive-compulsive disorder, is another anxiety disorder. And if you can remember that, you already have an example of a behavioural, emotional, and cognitive characteristic. Because OCD is defined by obsessions, which are intrusive, constant thoughts, a cognitive characteristic. The C stands for compulsions. Compulsions are the behavioural response to the obsessions. These are an attempt to deal with the constant intrusive thought processes. And of course, anxiety is the emotion felt as a result of the obsessive thoughts. But of course, we need to break down these characteristics into a little more detail and give some more behavioural, emotional, and cognitive characteristics. Compulsions are behavioural characteristics. Often compulsions are checking behaviours. This could be testing that the lights or the gas is definitely off, or checking again that the door is properly locked this time. Other common compulsions are ritual cleaning behaviours, which might be cleaning the kitchen down again and again, or possibly cleaning your hands to an extreme amount, up to the point where the hands become sore. These behaviours are performed repeatedly in an attempt to reduce anxiety. However, any anxiety reduction is only temporary. Another behavioural characteristic is avoidance. If there are objects or situations that the sufferer knows will trigger obsessive thinking, they may try to avoid them. So will try not to use the bin if they know touching the bin will cause obsessive thoughts about contagion. Or will avoid leaving the house if they know while they're out they'll be constantly worried if the door is locked. This avoidance can also result in social impairment. Meeting friends and taking part in social activities are difficult if you're not leaving the house and you're avoiding potential sources of contamination. This means someone with OCD becomes socially withdrawn. As OCD is an anxiety disorder, we can classify high levels of anxiety as an emotional characteristic. This extreme anxiety is, of course, a result of the obsession, the constant worst-case scenario thinking that defines OCD. Depression is also an emotional characteristic of OCD. This is the result of not being able to control the anxiety-causing thoughts, and the OCD symptoms taking over the sufferer's life, leading to issues like social withdrawal. Cognitive characteristics include obsessions. Obsessions are intrusive, irrational, and recurrent thoughts, and these tend to be unpleasant, catastrophic thoughts about potential dangers. Hypervigilance. This is a permanent state of alertness where the sufferer is looking for the source of their obsessive thoughts. For example, some of a contamination obsession could be looking at each surface they need to touch, like door handles, light switches, pens, and keyboards, and thinking about the potential threat of exposure to germs. This hypervigilance results in another cognitive characteristic, selective attention, or attentional bias. This means the individual with OCD is so focused on the objects connected to their obsession that they're unable to focus on other objects in their environment or concentrate on conversations. I want to thank everyone over on Patreon for supporting the channel. Because of you, I've been able to teach part-time, meaning I can make PsychBoost on YouTube for everyone. And a special thank you to Kat Posnick and Ahmed Ramani for supporting at the developer level. I do have extra resources that are exclusive to my patrons, so if you decide to sign up, you can grab those over my website. And these include over 100 exam question tutorial videos, of course including questions on the Psychopathology unit. I hope this was helpful, and I will see you in the next PsychBoost video.